Hi, my name is Dr. Christina Rahm, and I'm the chairman of the International Science Nutrition Society. I'm also the founder and president of Rahm Thomas University. I want to talk about a case study that was presented at the International Science Nutrition Society by Dr. Tina Bosnick, who is the Slovenian Doctor of the Year as well as Pediatrician of the Year. This amazing doctor was able to really work with a particular patient on asthma with chronic inflammatory disease. Asthma is one of the most common conditions affecting the United States. There's a lot of risk factors that go along with this, such as viral infections, air pollution, tobacco, smoke, and obesity. For the prevention of Alzheimer's, avoiding allergens, changing dietary habits, and really providing nutritional help can be an important factor. I want to talk about how this particular doctor worked with a female that was 7 years old to really help with chronic asthma. This 7-year-old female had regular medication that she was taking, but it only worsened her condition. At this point, the doctor turned to different proprietary blends that I want to read to you that really were able to impact the patient's health. The doctor used proprietary blend 1 with silica, vitamin C, and trace minerals. She was put on this blend in the morning, starting at 1 drop in the morning and 2 in the afternoon. She then progressed to 2 in the morning and 2 at night of these particular proprietary blends. After 2 weeks, she started having episodes of mucus discharge from her nose. Her stools were normal consistency, but her parents saw some amount of mucus in the stool. After they increased her dose to 3 drops twice daily, she started experiencing some mucus cough, especially during the night. These episodes lasted a week or so. The parents were advised to lower the dose, but at the moment she got better. Her stools became normal without any mucus and she started sleeping. This was able to show the doctor that it did help this particular patient to do 2 drops in the morning and 2 at night, and she saw a significant increase in the solution for asthma in this particular patient.